our 3 sites we have are all sort of in almost the epicenter, or the epicenter of this thing. The people that have experienced this, it's unbelievable what they described. Was that I always think of earthquakes as that you feel this rumbling and things shake and things gradually fall down. The description of people who were in these buildings was they were in these 7-story hotels, or we had an American team in the 2nd floor of a guest house, and it feels about as solid as you can imagine the world. These big, thick concrete walls and things. That they heard a rumble, and then the force of this thing hit, and the building was crumbled on the ground within 3 seconds. I mean, it's as fast as you can imagine. Nobody had a chance to even react to it. We had a team of 10 in this guest house. There was 4 people in the building, came down all around them. Not a single person got hurt. 10% of the population in the areas in our communities was dead, just like that, from these buildings. We haven't had a single death amongst our employees. The medical clinic we got in Port-au-Prince and Blanchard. Major structural damage of every building around it, not a crack in the medical clinic building. It's just amazing. Delson, Maurissier, the OBGYN that does our cervical cancer prevention stuff, his house collapsed next door. We were building a 2nd story. The 2nd story collapsed, and the main building around him held. And he has patients just walked out without anything. So we're counting our blessings amazingly. But the answer to your question is that we're staying out of the way of the people that can do the ER, the trauma, and we're just trying to find out how to provide support. They said they needed medical supplies to get in. Leogane is where we're building our hospital. It's like 20 miles out of Port-au-Prince. And so we were frustrated that all the news was directed into the county. And the Leogane had exactly the same destruction, but nobody was going there. We couldn't contact them on the phone. But fortunately, there were some people, the CDC and folks had a major operation out there. They weren't going to stand for that, so they got the news out there that we needed people there. And they found this small private air company down in Fort Lauderdale. And they said, look, you could just fly the supplies in and land them on this little road on the outskirts of town. And they said, I don't know if that's a good idea. So what if the drug dealers do it? You guys not as good a pilots as the drug dealers? So sure enough, the guys took it in and landed. First time they went in, there was some debris on the road. It was a little hairy taken in, but when the residents realized they were going to start landing planes there, they cleared off the road, and now this was the 3rd day in a row we got supplies in. The hospital gave us enough operating room supplies. We filled up a 26-foot truck yesterday and another one today that's going down to Fort Lauderdale to be flown in. It's day by day, just trying to figure out what it is you need and stay out of the way that people don't drink the water that people on the ground need to do until it's time to go in and do that. But lots of blessings out of it. Our NGO was trying to figure out how to get networking and computer access to things that were here. They hired a guy named Louis Fox to be a consultant to provide IT needs to Duke's Global Health sites. Our nonprofit actually has an MOU with the Global Health Institute. And they said, there's no money for people that just have an MOU. You're an NGO, you can raise your own money. Well, when this happened, all of a sudden, we're getting 2 networks and a whole set of phones I'm going to pick up Thursday morning to take down. So there's some blessings and silver linings in the things that are there. So it's just sort of day by day and trying to figure out how to react. It'll take a long time to get back where we were.